Hi out there, my nurse friends. This is Naomi again, wanting to talk more about hospital violence and how we define that in hospital settings or any healthcare setting for that matter. I have given a lot of thought the last couple of days after I asked for some input on how everybody perceives violence, and I thought I would share my definition of healthcare violence is anything that makes a healthcare worker, any healthcare worker, feel unsafe. It can be verbal or physical. It can be from somebody who's completely alert and oriented, or it could be coming from somebody who is an acute metabolic pathology going on. They're, going through some alcohol withdrawal or opioid withdrawal. They've got an acute delirium going on. It really doesn't matter whether the person at that moment has capacity or not. Violence is violence, and so when we're treated in a way that makes us feel unsafe, that's not okay. And right now it seems like there's so much focus on the person who's alert and oriented and choosing to make a threat, and that's great. We have to focus on that, and I don't want to in any way take away from that. But I think that it's really important to understand no legislation or new laws that say it's a felony to assault a healthcare worker is going to protect you. And it's certainly not going to help us when some of the people or patients perpetuating violence against healthcare workers are actually patients that don't in that moment have capacity. They, like I said, are encephalopathic for whatever reason. They're in acute delirium. And those patients are every bit as aggressive and difficult to deal with. But unfortunately, most of the time it feels like we're just expected to put up with that. That's part of our job. But really, all it's doing is adding to the nursing burnout. We're heading into an era where there's going to be a nursing shortage, and nurses or healthcare workers, let's not just say nurses, healthcare workers are feeling burnt out and developing their own level of PTSD from what they encounter every single day. When I think about some of the most unsuspecting victims of healthcare violence, I always think about the lab, because at least when you're working on the unit, you've got shift-to-shift report from nurse to nurse to PCA to PCA. There's conversations with doctors, and kind of we all know that somebody's misbehaving for whatever reason, but then the lab goes in the room and they have a sticker that says a name, a birthday, and what color tube they need. They have no idea. Same with EKG or just any of the consults. They could go in a room and not know. So that's where I'm hoping we can make some progress in coming up with ways to stay safe in healthcare. So I don't want to just ramble on. I want to put it out there that I define violence as anything that makes you feel unsafe. And again, ask for some input on the things, the situations you've been in that you did not feel safe, and ways that we can work together to keep everybody in a safe situation at work, respect everybody's need to be able to function well and give the highest quality care. So those are my thoughts for today. I'm hoping that I'll get some feedback from everybody. In the meantime, stay safe, support each other, and stay calm and nurse on.